Hi guys. So my topic was on Pediatric Right to Die, and as we learned in class, there are a number of different reasons why this may have to be discussed. There are both acute and chronic illnesses like cancer that may lead a family to refer to a brochure like this. And during the end of life, it is important for a family to know what their options are. Did you know that despite all of the advances in healthcare, thousands of children die annually from life-threatening illnesses, and 80% of children who die in hospitals do so in the PICU? Children are seen as the symbol of health and hope in life. So this can be a very difficult conversation for parents to have. However, it is important when an illness becomes too hard to fix and living causes too much suffering to consider the right for a child to die comfortably. Terms that are important to know in this process are euthanasia, which is when someone other than the patient ends the life of a dying patient. Assisted suicide occurs when a patient is given the means to end their own life. Both are illegal for children in the United States. When treatments aren't working and death is expected, it may be acceptable to stop treatments that cause pain and suffering to the child. This will allow the healthcare team alongside the family to focus more on promoting comfort and quality of life for the child rather than extension of life. It is important to understand a child's concept of death in order to communicate better with them about what is happening to them. And as nurses, we can definitely help facilitate that conversation by explaining to parents what developmental stage the child is at. For instance, infants and toddlers, they react more to the pain and discomfort of an illness rather than the idea of death. So the presence and maintaining ritualism is what matters most to them. Preschoolers think of death as punishment for their actions or thoughts. They think that death is a kind of sleep. So the parent's presence is going to help relieve that separation anxiety. School-age children also think that they can cause death with bad thoughts and deeds, so they may be feeling a lot of guilt and fear. By age 9 or 10, however, they begin understanding that death is irreversible, so it's important to talk through these feelings. During this time, there are various considerations for terminal care that a family would have to make. Some families prefer home care so the child can be in their most familiar environment. Hospice is an organization that specializes in the care of dying patients by managing the physical, psychosocial, and spiritual needs of families. Most insurances cover this service. Families may also request this care at home. If these options are not possible, then families can also receive care in the hospital where they can make the environment more familiar by bringing the child's toys. A child's healthcare team should be able to help families connect to local resources. I've listed some local Sacramento and online resources as a starting point. Research has found that a good death encompasses a supportive environment built on ethics and centered around the parent-child relationship. Nurses should do everything within their scope of work to facilitate what a good death means for a family.